Coma is a profound state of unconsciousness where an individual is unresponsive to external stimuli, such as sound, light, and pain. It is a medical condition that results from a severe disturbance in the functioning of the brain. Comas can vary in duration, from a few days to several weeks or even longer, and they can have various causes and levels of severity. Here is a full overview of comas, including their causes, symptoms, diagnosis, treatment, and potential outcomes. Causes of coma. Traumatic brain injury. Comas can result from severe head injuries, such as those sustained in car accidents, falls, or assaults. Stroke. A stroke can disrupt blood flow to the brain, leading to coma if not promptly treated. Brain hemorrhage. Bleeding inside the brain, known as intracerebral hemorrhage, can lead to a coma. Infections. Severe infections of the brain, such as encephalitis or meningitis, can cause a coma. Metabolic disorders. Conditions like diabetic ketoacidosis, severe electrolyte imbalances, or liver failure can result in a coma. Drug overdose. Certain drugs, especially opioids and sedatives, can depress the central nervous system and induce a coma. Hypoxia. Prolonged lack of oxygen to the brain can cause coma, which may occur due to drowning, suffocation, or severe respiratory failure. Toxic exposure. Exposure to toxic substances, such as carbon monoxide or certain chemicals, can lead to a coma. Brain tumors. Some brain tumors can directly affect brain function and lead to a coma. Symptoms of coma. Unresponsiveness to external stimuli. Closed eyes and no visual tracking. No purposeful movements. Absence of speech or verbal response. No voluntary reactions to pain, example, pinching or prodding. Altered vital signs, including irregular breathing patterns and changes in heart rate and blood pressure. Diagnosis. A thorough medical history and physical examination are conducted. Brain imaging studies, such as CT scans or MRIs, may be performed to assess brain structure and any possible abnormalities. Blood tests are conducted to check for metabolic imbalances and infections. Electroencephalography, EEG, may be used to assess brain activity and detect seizures. Lumbar puncture, spinal tap, might be necessary to evaluate cerebrospinal fluid if an infection is suspected. Treatment. The primary goal is to identify and address the underlying cause of the coma. Supportive care is provided to maintain vital functions, including ventilation and hydration. Medications may be administered to control seizures, reduce intracranial pressure, or treat underlying conditions. Surgical interventions may be required in cases of brain injuries, tumors, or bleeding. Prognosis. The outcome of a coma depends on its cause, severity, and duration. Some individuals may gradually recover consciousness and regain normal function. Others may remain in a persistent vegetative state or progress to a minimally conscious state. Unfortunately, some comas result in severe and permanent brain damage or even death. Rehabilitation. For those who regain consciousness, rehabilitation therapy, physical, occupational, and speech therapy may be essential to regain lost skills and function. Long-term care. Patients who experience significant brain damage may require ongoing care and support, which could include specialized facilities or home care. It's important to note that comas are medical emergencies, and prompt diagnosis and treatment are crucial to improve the chances of a positive outcome. The prognosis varies widely based on the individual case, and long-term recovery can be highly variable. Family members and caregivers play a vital role in the care and support of individuals who have experienced a coma.